We will begin by explaining the way the body normally functions. The brain is divided into two parts, the front and the back. The front is further divided into the right side and the left side. The right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body, in addition to performing other functions. The back part has areas that control all functions necessary for life. The heart and two kinds of blood vessels are responsible for sending and receiving blood from all parts of the body. The blood that goes from the heart supplies every part of the body with oxygen. Oxygen is necessary for life. This blood is carried by the vessels shown in red color. These red vessels are called arteries. There are two red arteries that supply the right side of the brain. The ECA, or the external carotid artery, supplies the coverings of the brain, and the ICA, or the internal carotid artery, supplies the inside of the brain. Similarly, on the left side, the ECA supplies the coverings of the brain, and the ICA supplies the inside of the brain. The back part of the brain is supplied by the basilar artery, which is formed by two arteries called the vertebral arteries joining together. After the oxygen from the blood has been used by different parts of the body, this blood is sent back to the heart by the vessels shown in blue color. These blue vessels are called veins. It is important to know that normally the red arteries and the blue veins should not connect to each other. Now we will explain the problem the patient is facing. In some patients, there may be abnormal connections between the red arteries and the blue veins. For unknown reasons, these connections may swell and become big. This is not normal. Doctors call this problem an arteriovenous malformation, or AVM. An AVM is like a complex knot. It may be located anywhere in the brain. An AVM has three parts. The first is the red artery that brings blood to it. The second is the tangled mass or knot of blood vessels called the nidus. The third is the blue vein that takes the blood away. In an AVM, the artery brings in more blood than normal and so is under high pressure. As a result, the AVM may rupture, resulting in bleeding in the brain. If an AVM has ruptured and caused a blood clot in the brain, it needs to be treated as early as possible. This is important because once the AVM has ruptured, there is a high chance of it rupturing again, and that increases the risk to the patient's life. We cannot predict when the AVM will rupture again. It could be within the next few days, months, or years. The patient may experience the following symptoms: headache, seizures, loss of consciousness. There are three kinds of tests that can be done to check for this condition. A CT scan is the first test that is done to find out the cause of the problem. If there is a blood clot, a CT scan can help find its location. It can also show other features that help with the diagnosis. An MRI scan may or may not be required immediately. If an AVM is suspected, an angiogram test is done to identify the arteries that supply it, the nidus, and the veins that drain the nidus. For the angiogram test, A needle is usually inserted into the artery of the right leg. Through this, a catheter tube is passed into the arteries of the body until it reaches the brain. A liquid substance called contrast is then injected through the catheter tube into the brain. This angiogram test makes it possible to see the blood vessels in the brain. Images are then taken on the screen inside the DSA room. These images show details of the condition. Now we will explain the treatment options available. In our department, we do a treatment that happens inside the blood vessels. This type of treatment is called embolization. For this, we do not open the head of the patient. Embolization puts medication or synthetic material through a catheter into a blood vessel to stop blood flow to an abnormal area. This treatment is done the same way as the angiogram test. We will put another catheter tube through the arteries till the brain. Once the catheter tube reaches the AVM, we will put a medicine to close it. It may not be possible to close the AVM completely in one session. If it does not happen in one session, the patient might have to undergo the procedure again. At times, the AVM is large and cannot be completely treated by only embolization. In this case, the patient may have to undergo another treatment after embolization. For this, there are two options available, and this decision will vary from case to case. The first option is gamma knife treatment, which is a kind of radiation therapy. The second option is surgery. There are certain risks involved in this treatment. A small clot can form in the leg where the artery is punctured. There can be injury to the arteries of the brain when the catheter tubes are being inserted. During embolization, the AVM can rupture again. If this happens, the condition of the patient can become worse because the rupture causes a blood clot in the brain. Depending on the size and location of the AVM and the size of the clot, the patient may need urgent surgery to remove the clot. As a result, the patient's hospital or ICU stay will increase. They can also have some new problems to the brain and the body, which can take time to recover. At NIMHANS, we are experienced in treating AVMs. However, an AVM is a complex condition, and so the possibility of complications is high. There is a small risk to the life of a patient undergoing treatment for a complex AVM. We hope that this presentation has helped you understand the patient's condition and the treatment for it.